It's a mind-blowing statistic. On average, every 2 seconds, someone in Canada goes to a hospital emergency room. That's around 1,800 patients during this newscast alone. In tonight's encore presentation from our special series, Public Health, Private Lives, we pay another visit to Toronto's Sunnybrook Hospital and turn the spotlight on nurse Spina, a frontline worker in the country's biggest trauma centre.
Westbound QEW troubles heading toward third line, eastbound for side.
It's coming! Blood, brains, you name it. We see it. You watch it, we live it. But it's fun!
Okay. On the shoulders, hip. So, on your call, 1, 2, 3.
It can be pretty crazy in here sometimes, intimidating. And bones and I don't do well, so if the bones are not in the right position, I don't really like to look. The brain can come out the ear, I'm like, okay, we'll just cover that up. What happened to you? What happened? You can't speak? Okay, he's having a lot of trouble breathing. They always said, you can't emergency nurse for more than, I think it was 3 years, and then you'll burn out. But I've never burnt out, but I think that's because it's my soulmate job. Oh, more sedation? Yeah. Oh shoot, I don't have rock.
Number 1, environmental for isolation, please.
If I'm hustling on a trauma, we're talking no food, no drinks, hardcore, go, go, go. 2 and 3. It can be pure chaos, pure hectic, pure draining, pure exhaustion. So his IVs really are supposed to only be at 100 an hour each.
Families here?
I don't know. Did we find family for him?
No, that's what we came here for.
Okay.
Let's just look for an emergency contact. Thanks. Well, get a jail-free card.
He's funny. He's a very funny guy.
Okay, I'm gonna call these numbers. Hi, Nancy. It's Constable Casming with the OPP Aurora Detachment. It's 2:25 p.m. today.
It's always scary when this happens. Imagine getting that phone call. When I see the family, sometimes I'll cry. Sometimes I cry because of what they're saying, and I can't imagine the pain that they're going through. When it's a back-to-back trauma, you don't have the time in between to think about it. There's no time for emotions. Just breathe, take a deep breath. Oh.
Sorry. Ooh. I know it's gonna be a little uncomfortable. Hold on a second. Go.
Maybe 200 is saline in maximum.
Almost there. I'm sorry, I know it's uncomfortable.
Attention, for security and safety reasons, the emergency department is temporarily obliged to restrict visitors' access into the department.
We've gone on a emergency lockdown. We just received the stabbing, and we don't know whether the person's gonna come back to check on them or finish it off or whatever. So we just closed down to protect everybody. We have had a few scares, definitely. I've had about 8 big guys around me asking me where their friend is. I feel bad. I don't really know what happened, but I feel bad. I feel bad for everyone. The patients will talk about what's happened or who did it.
Actually, they just threw the phone in the garbage.
What phone?
The guy who lost his phone, I tried to return it.
I don't know what you're talking about. La, 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 la. Like you don't want to hear it, right?
The guy who lost the phone, he called me, and he goes, do you have your phone? I said, yeah, I found your phone, and you can take it. I'm at Timmy's. And I tried to return his phone call, and he wanted money from me and stuff.
Oh, that's what happened. I've heard some interesting stories in my career. That one's up there with interesting. Lots of times it was I was just minding my own business and someone jumped out at me and took a knife to me. Could be, you never know. Either way, at least he's alive and well.
If anybody pays Dr. Denny, can you please...
So now
Bye.
I love you.
Love you too.
I'll see you Tuesday.
Don't touch it.
Come on, you guys. Being a mom is a tough job. Being a great mom is a really tough job. And I'm trying to do it, but it's very tough. Home. Okay, let's have a race. Who can get their pajamas
I
on?
hate doing that because I always do.
I have 3 boys.
And I lost.
Boys are very active, very busy. Hold on, Chris, no cheating. Get back at the line. Nikki, move out of the way. It can be very hard for me because here I am giving my all in all at work, and now I have to go home and give my all in all to these children. Let's go. Sometimes I will cry, and they'll look at me like, uh-oh. Let's go. And I'm like, you just don't understand what I've been through today.
I win. No.
And sometimes I'm running around with a spatula. Get upstairs! But I don't use it. It's just a tool to make me look powerful. I asked you to go to your own room. Stop. Go to your own room. Happens to every mom. And if they say it doesn't, they're lying. Let's go. In your bed. You need to go to bed now. I unfortunately can't say when your dad comes home, he can handle it. It's time to be quiet. Enough is enough. I'm losing it on you. I do get sad. I do get insecure. I do have times of feeling needy. Sometimes I do get bummed out.
Nurse to room 15, nurse to room 15.
Back to work. Hello, Randy.
2024.
Happy birthday to you. Happy
Laughing? Are you laughing or crying? You better be laughing.
Happy birthday, dear.
What is it?
What's your name?
Stella.
Stella. Happy birthday to you. Are you 1? Are you 2? Are you 3? Just kidding. Some nurses are very professional and they want to be perceived as, you know, the straight and narrow. Let me strike a pose. There shouldn't be giggling at the desk and there shouldn't be, you know, horsing around. But then you can have the people like myself and Dean who feel that laughter is the best medicine. Dean hasn't come out of the closet. If I didn't do that, I would probably burn out. Because in a flash, we could be in chaos.
Go down, you're gonna end up on the left. Straight ahead and to the left.
So 11:51 is when it happened.
We have no ID on the gentleman, no patient history.
It's a life or death situation. The man has significant fractures. He has a significant head injury. This patient's unstable, very unstable. Oh, yeah, shit. When did this start? You get used to seeing death. It doesn't bother me, really. Come on, sir. Don't go.
I can't get a pulse. Can you please carry those hands at the corner?
Sue.
Yeah.
Move this.
Everything off.
That sucks. Poor man. Thank you. Sometimes, this is gonna sound pretty bad, but if the patient comes in and they're not identified and there's no family, it doesn't hurt so much if they get pronounced. there any ID or anything?
No, not that it looks like.
But there's money.
Yeah, there is money in here.
It hurts more when I see he's carrying a bag that has stuff in it. That hurts. I don't know why. It just makes it more real. Does someone want to set the table? Any takers?
No. Mommy and Daddy don't like each other.
Yes, we do.
Well, why don't you go with each other, like, you know, like blah, 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 and sit down and live with each other? That's called a family.
You're right. Christopher asks me that a lot. I think my career may have had an impact on my marriage. This job is very demanding. You need to have somebody that's compassionate, that's going to understand that what you've done is important. It is, I have saved a life or I have lost a life.
Nurse to room 15, nurse to room 15.
This is eating on the run. Sometimes people don't respect nurses as much as they should. They think of you as being a slave, there to help the doctor. What is your chief complaint today? But I'm the one that's treating you. If I don't give you this, you're gonna die. But go ahead, be mean to me. That's fine. That gets really frustrating sometimes. We're gonna pull a joke on one of our very green staff. Where's the body bag?
A body bag. Where's a body bag?
Gonna be hilarious. Okay.
Cars. Give me a hand.
How come you don't call Will?
What?
Will.
Just give me a hand. Will's checking 14. All right.
Is there blood all over?
No. Actually, I don't know. He must have died of intra-abdominal bleeding because really there's no blood at all. Okay, turn towards you.
What? Turn.
Dean, turn. Patient.
Don't do that. Don't shake that. I gotta put the band up.
You're turning towards you. Okay.
Stay. That is so bad. Christ. They look familiar.
We have to be real. We have to be able to laugh at times when it might not look appropriate, but that might be our coping mechanism. It was quiet today. That's why we could do so many jokes on each other and have a little bit of fun. I feel ready to go have a good time with my girlfriend. Yummy. I think that when I initially got married, and have children, you kind of lose who you are. And I think going through my separation, which is hard, it's definitely not an easy thing. Through that, my one hope was to re-find who I am as a person, and now I'm using this time to find myself and who I really am back again, and be who I am. And whoever, if they don't like me, that's okay. They have a right not to like me, and if they like me, well then let's go have fun. That's all. Don't lose me. Until then, I'm just gonna live life and enjoy my friends and my family and, live life to the fullest. So we're gonna have fun. Yay! I'm on fire. We're gonna have so much fun.